In England, trauma is the commonest cause of death in those under the age of 40, with survivors often suffering with long-term disability. It is therefore extremely important to ensure that those who have been affected receive the right input and care to continue to have a quality of life following their serious injury. Allied health professionals play an integral part in this process, from admission, throughout the patient's hospital stay and long after discharge. The high quality care that patients receive, not only medically but therapeutically, would not be possible without the excellent multidisciplinary approach that Allied health professionals here at North Bristol Trust do so well.
Radiographers working in CT are responsible for the acute imaging of a patient in major trauma. A trauma protocol CT scan is performed to assess the patient's head, neck, chest, abdomen and pelvis for significant life-threatening injury. The trauma protocol has been optimised to help meet the 30-minute imaging target, ensuring patients receive diagnostic imaging and a result as quickly as possible in the acute situation.
As speech and language therapists, we work closely with the multidisciplinary team with people who have tracheostomies. Our aim is safe tracheostomy care, working towards the removal of the tracheostomy. Once the person has started weaning from the ventilator, as speech and language therapists and physiotherapists, we will assess them and set goals. This involves assessing a person's ability to communicate, cough, swallow, manage their secretions and airway patency. We also regularly use specialist interventions such as a fibre optic endoscopic evaluation of swallowing assessment. This involves passing a scope with a camera on the end through someone's nose and into the top of their throat. This allows us to visualise the structures of the throat, their volumes of secretions in the throat, what their sensation is like, and the risk of food, drink or secretions going down the wrong way into their lungs. This is really helpful to guide their rehabilitation and onward care.
Dietitians are responsible for the nutritional management of patients following a major trauma. On admission to the intensive care unit, patients are often sedated and ventilated, which means their nutritional needs are met via a feeding tube. The type and volume of feed given is specific to the patient's needs. In the recovery phase, the dietitian will work alongside the speech and language therapist to ensure that the nutritional needs are met in the safest way, either via feeding tube, a texture-modified diet, or the use of nutritional supplements. Working together with other AHPs, we support rehabilitation and recovery throughout their inpatient stay.
Physiotherapy plays a significant role in the recovery of a patient following a major trauma. We may initially be involved in the respiratory management and tracheostomy weaning. We would also be involved in the acute phases of rehab, which, dependent on the patient's needs, could involve working on sitting balance, sensory rehab, upper and lower limb strengthening, and progressing to standing and walking as appropriate. We work towards patient-centred goals and also provide advice for their ongoing therapy needs throughout the pathway.
Occupational therapists are specialists in assessing a person's ability to carry out everyday activities and tasks. We consider the impact of an injury on someone's cognitive, physical and social abilities with the purpose of enabling individuals to reach their maximum level of independence in all aspects of life. As an inpatient occupational therapist, we work closely with other members of the multidisciplinary team, including speech and language therapists, completing joint cognitive and communication assessments with the aim of getting someone home safely from hospital, identifying the support required, or helping to make decisions around ongoing rehabilitation needs.
Here in the physiotherapy outpatient department, we focus on continuing rehabilitation after patients are discharged from hospital. This can involve a one-to-one session or group therapy in the gym or in the hydrotherapy pool. With the individual's goals in mind, the team and I must be dynamic and innovative with therapy to ensure that it's both effective at meeting the therapeutic need, but also that it's engaging and enjoyable for the patients. Outpatient appointments are aimed at getting people back to their jobs, hobbies, sports, or just generally being active with their family and friends.
Prosthetics and orthotics is a dynamic and expanding allied health profession. Technically, prosthetics and orthotics are different health disciplines, but their common goal in rehabilitation unites them into one cooperative entity. Prosthetics involves the use of artificial limbs to enhance the function and lifestyle of persons with limb loss. The prosthesis must be a unique combination of appropriate materials, alignment, design, and construction to match the functional needs of the individual. Orthotics involves the design and fabrication of external braces as part of a patient's treatment process. Orthoses may be used on various areas of the body, including the upper and lower limbs, or even the spine. Orthotists and prosthetists are instrumental in the rehabilitation process following major trauma, often combining with other allied health professionals simultaneously throughout the rehabilitation process.